Hi, good to see you again. I'm Graham Martin, I'm the recruitment guy with another 5 minutes careers interview. We're here today with Dr. Eric Toni in his consulting offices in North London. We're very, very fortunate to get Dr. Toni to talk with us because he's a very busy guy. I'm probably going to use the wrong phrase. I'm going to say cosmetic surgeon. I'm sure we're going to talk about that in a little bit, but ostensibly you look after people and the way that they look and the way they feel because of what they happen, what you do to them. Is that right?
That's correct, but I'm not a cosmetic surgeon.
So can you explain to us what you do?
My background is as a general practice background. I'm a medical practitioner, and I developed my interest in this many years ago. Basically, out of a lot of my work was involved the effects of ageing on people, and I thought, well, why not do the ultimate preventive medicine, which is what I do now.
So did you start off as a GP in surgery and then evolved into this?
I'm a graduate of Middlesex Hospital, which is University College London. I did my house jobs out in Essex and in Basildon. Then I came back to Bath to do gynecology. Then I went on to do my GP training in Epping. And then I had my own practice. I was also used to run the skin clinics at North Middlesex Hospital, and that's where my interest began, and I followed on. And in 1987, that's a long time ago, but I started doing collagen implants.
And that's injections, is it?
Yeah, it's injections. And in the first ones, they were very expensive, and people could be allergic to them, and so you had to do a test on them before. They weren't very good, and they didn't last very long, and there was a lot of tut-tutting about GPs like me doing such injections and such procedures. I developed on from there. Then I went on to start treating veins, broken veins, and then Botox came along, and I started doing Botox. And I did 2 BTECs in laser technology. I started doing laser treatments as well, so I would not do any procedure.
So lots of training, lots of education,
lots of continuing education. Nobody knows everything. Everybody can learn something. And nobody ever stops learning.
So you specialise quite specifically. So you don't do breast implants or liposuction, that kind of stuff.
No, but I'm the man that knows how to and where to refer to. I think the essence of a good medical practitioner is to know his or her limitations and know where to send people to be referred.
What's the best bit about your job?
I love it. I like to say I used to be a GP, but now I'm happy.
But you help improve people's lives by the way that they look and how they feel about themselves, I suppose.
And this is a happy job. It's not a job of misery. It's not a job of illness or sickness. It's making. I look at myself as making people make the best of themselves.
And what's the worst bit of the job?
Nothing.
Nothing
I
at all?
can't think of anything.
Paperwork?
No,
I'm
completely paperless. I have my practice is completely computerised. I keep all my records on computer. I can do a complete audit trail of everything I've ever done, and that's why I've run it from day one, and I'm very happy.
Fantastic. And
when I was a GP, there were lots of negatives. You know, the insurance reports, the sort of the house visits at 2 o'clock in the morning, and things like that. But I do a fair amount of travelling because I have clinics around the country, but I can't think of anything really bad about it.
If you would suggest that somebody wants to look at getting into this sector, if they're interested in it from a medical point of view or from a mental point of view, how people improve by the way they look, what would you suggest they do? Pursue a normal medical career as you did, or would you suggest they come at it from a different angle?
I think, Graham, you hit on something very, very important there, the mental assessment of your patients. And I don't think these procedures should be undertaken by anybody without a medical background. Okay. Body dysmorphic syndrome, which is how people feel about themselves, is very, very important. And it's very important for people to recognise that somebody who's gone over the top.
And we've all seen pictures of people who've had too much plastic surgery, and the surgeons just keep on making the money by going back and doing work again and again rather than saying enough.
Unfortunately, the sort of there's integrity is
slightly in question.
yeah.
And if so, really, if somebody was interested in saying, right, I'd like to do what you do, and we're getting to the end of our 5 minutes, so we could probably talk for ages on this, but if somebody said, look, they'd like to pursue this a little bit more, what money could they be looking to earn, either starting off or maybe after 10 years, generally around, let's say, a major city in the UK?
Well, I have to say that you really, if you have to do what I did, I come via the medical degree, that you'd be earning the same as a GP.
Right. So pretty good money, you know, in excess of 80 to £100,000, I suppose, after a degree of
that's an average.
Being in tenure. Yes.
Yeah. I would say that I'm not in this for the money. I am in this for the lifestyle, and I enjoy what I do.
Well, you look relaxed. It's a lovely consulting environment. You haven't got phones jumping off the hooks. It's got some nice artwork. It's clean and tidy, as you say, without a lot of paper. If there was one piece of advice that you'd suggest to somebody, and you recommend that they pursue it via the medical route, but there's one piece of advice, maybe somebody's watching this, maybe they're a medical student or they're interested in going to university to study medicine, and they would like to know a little bit more about this, what do you suggest it would be?
Don't cut corners. Make sure you're adequately trained. Never do anything that you're not trained to do, and make sure you have the appropriate insurance, the medical indemnity.
Yeah.
Yes. Never go deeper than you dare.
In more ways than one, perhaps.
Exactly.
Yeah. Well, there you go. We've got some really interesting information and good advice, and it's an area that I wasn't that familiar with. As you can see, you know, I probably need quite a lot of work doing, but nonetheless.
I don't.
Okay, great. Well, that's all we've got time for.
Okay.
Dr. Eric Toni, thank you very much.
Yeah.
So there you go. One of the most fascinating 5-minute careers interviews. I know we've overrun. Hope you enjoyed that. It's Graham Martin, the Recruitment Guy. Say goodbye.